In the last class, we were discussing the immunoelectrophoresis technique, but the video discontinued in between. So in this video, we are going to finish up the technique of immunoelectrophoresis. So try to understand the protocol of how is it performed. So we take the glass slide, and onto that we will coat the glass slide with agar. We will make a well in the center where we will load our particular antigen. After this, the important step now comes is that we have to, after loading, we have to introduce this into a container. Let's say this is my container, and in this container I'm viewing it from top. I have filled the buffer inside it, and the whole of this, what I have, this part, it will be, wait, the whole of this slide I have to keep it inside this particular container. Then what do? I will then here add my particular let's say positive terminal, and here the negative terminal, and now I will allow the electricity to flow through it, or the electric field to flow through it. What happens is that in this particular serum, whatever molecules we have, these molecules might have the amino acids which are negatively charged. For example, we have the aspartic acid, we have the glutamic acid. If these are the amino acids in these molecules, the molecules will be definitely attracted to the anode. So they will move here and they will arrange here based upon the amount of charge. Similarly, based upon the amount of charge, and if they are rich in histidine, arginine and lysine, they will move towards the cathode and they will arrange here. After this, for a certain period of time, after that we will stop applying the electric field, and then afterwards we are going to make the troughs or the lanes parallel to the place where we have added the particular antigen. This was the central well here from where the things have diffused already. Now in this we are going to add, in this lane we are going to add the polyclonal serum. The polyclonal serum will be added on both the lanes, and it will automatically diffuse itself into the whole of the lane. Now polyclonal serum is that which is receptive to many different kind of antibodies. Now from the patient, please remember that we have taken the antibodies. In the serum of patient, there were certain antibodies which have spread themselves onto this plate, and now we are adding a polyclonal serum which contains those antibodies which are specific to these antibodies. So now the patient's antibodies are acting like antigens. For the simplicity, you can understand like this, that the patient's antibodies are antigens, and now here we have the antibodies which are specific to these antigens. After a certain period of time, the number of diverse antibodies which we were having here in the patient, all at that place will be getting the diffusion line. So more the diverse antibodies inside the serum, more the diffusion lines will be getting. For example, for IgA we are getting here, so definitely some antibodies came from here and they had formed the equivalent zone. Similarly for Ig lambda, IgG and IgT. Now there is a condition which we call as myeloma. So in the patients who are suffering from myeloma, the IgG concentration inside the blood increases many folds. So majorly the other antibodies are not produced, and majorly we have the antibody IgG present inside the serum. So when we are going to perform the immunoelectrophoresis of such patient, or in such patient serum, the IgG will obviously displace itself and will be occupying more and more of space because the concentration of IgG was more. Here when the diffusion takes place, what happens is a large and a broad and a sharp curve is obtained here. So the zone of equivalence here is very large. So we can easily do the comparative analysis, where we can say that for the normal serum it was this much of zone, but here we are getting this much amount of zone. So definitely the IgG is very high inside the particular patient, and that might be a condition where the patient is suffering from myeloma. So as simple as that is the technique of immunoelectrophoresis.